Swarming occurs at a high tempo. Often, you are blitzed by one set of converging nodes after the next. They may not hit you. However, to inflict mental trauma and possibly eventual biological damage, they don't need to. The fear-potentiated startle is a mostly unconscious physiological reaction of the sympathetic nervous system to fear-inducing stimuli. The stimulus that's perceived as a threat can be auditory or visual. It can be a bright light, a sudden noise, or quick movement in your direction. The stimulus doesn't need to be proximate. It can be distal, and I've noticed this response can be generated at about 40 feet. The release of adrenal hormones into the bloodstream incites physiological changes that prepare the body for action. These changes include eye blinking, jaw clenching, the retraction of the head, arms, and torso away from the stimulus, and an increase in respiratory and heart rates. Note, these reactions are not just mental, they are biological, and the reason that is important will be discussed shortly. These are possible and intended effects, not necessarily how you'll react. If you know you're under attack, you can reduce these effects. The FPS can be modulated. That means it can be adjusted with additional stimuli and proximity adjustment. A distal stimulus will generate less of a response than a proximate one. Studies on animals show the position, speed, and size of a converging stimulus can also modulate the response. So basically what this means is the more negative stimuli you add to the FPS, then potentially the greater the response. If we take a large noisy truck, for example, the FPS has already been modulated. Instead of a car, it is a larger vehicle, a truck. We've also added noise to the equation. Noise alone can generate an FPS. Continuing with our example, what if that truck was painted a color that you've already linked pain to? So if it was red, and you were previously swarmed by red anchored nodes, then the response has been modulated. Taking it further, what if instead of converging near you, it almost hit you? That is a faint collision. Continuing, what if that vehicle is used as a billboard for a PSYOP product that is part of a theme to instill fear? The response has been modulated again. Once more, these are intended and possible reactions, not how you're going to react. Yet, you can see how one event can be used for a debilitating compound attack. The use of audio and visual stimuli to generate an FPS is done repeatedly to keep you in a constant state of fear with abnormally high heart and respiratory rates. This ongoing stimulation of the SNS has been termed sympathetic hyperactivation. When it happens, biological resources are distracted from growth and maintenance and focused on systems necessary for survival. The results of such chronic stress include anxiety and depression, violence, fatigue, tremors, slow healing, growth degradation, aches and pains, rapid heartbeat, high blood pressure, increased risk of heart attack and stroke, impaired immune system leading to biological disease. Once again, let us observe these effects are not just psychological, they are biological. So, FPS-induced sympathetic hyperactivation can incite internal physiological changes that result in biological damage. Therefore, although no contact has been made and there's no visible injury, the FPS is, in a sense, a physical attack if it is done recurrently because of its potential to inflict delayed biological injury.